I had tetracycline as a kid due to some allergies I had, which is not good for teeth enamel. I didn't know it at the time, but as I grew older, found out I had Sjogren's syndrome, which is not good for teeth either because I have a lack of saliva in my mouth. I've had numerous root canals, caps, bridges, extractions, any of the above. When the doctor and I first started, there were broken teeth and some issues, and there was root canals, there was crowns. He and I had had some discussions about maybe someday doing implants, but that was 10, 15 years ago when I first started coming here, and as time went on and he root canaled and capped and crowned and bridged, it just led into the conversation of having implants. Well, as my teeth kept getting worse, we did the bottoms first, and then we did the tops. We did the bottoms first because I don't smile and you don't see my lower teeth generally speaking, so we went with those first. We had all the extractions done. He had the 7 implants put in, and then when we had the top ones done, I went there, had them extracted again. He put in 6 implants, and for his reasons, he put in just the one piece in the top. When we were doing that, the implants were in, and being you can see my upper teeth, he made me a denture that I would put in over them till my gums and everything healed to where you could put the implant in. Yeah, it's a life changer. I have dealt with dental issues for 25 years of my life. I have no more dental issues. I brush them, I water pick them, and I go. I have no more cavities, I have no more breakages, I eat what I want. Beef jerky, I couldn't eat beef jerky for quite a while. And now I chew through it like it's butter.